Chip.
Hello everyone, my name is Erin Dominguez and this is my informative speech. Ever since my sister was a child, she always had erratic emotional behavior. And my parents always thought it was a discipline problem. We watched her moods go from excited and happy to a low depressed state in the matter of minutes. I remember watching her high school basketball games, and if she would miss a shot or overturn the ball, she would stop playing. And sometimes have to sit out for the rest of the game because she couldn't change her mood over those 1 or 2 mishaps. While in college, my family and I started to notice a difference in her. And such of these things were hyperactivity, reckless behavior, and poor judgment. After going to therapy, forced by my parents, she was diagnosed with bipolar disorder. Ever since that day, I've been learning about it. I've done research, read articles and websites, and become well informed about the disorder for the sake of my sister. Today we'll discuss what bipolar disorder is, some of its symptoms, and treatment options. Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. People with this condition go back and forth between periods of very good or irritable mood and depression. Basically, their mood swings between manic and depressive states that are very quick. They are very different from the normal ups and downs that everyone goes through from time to time. People that usually have bipolar disorder usually develops in them around late teens or early or as a young adult, or right before the age of 25. Doctors and scientists don't know exactly the cause of the illness, but according to the National Institute of Mental Health, they think that it's a biochemical, genetic, and environmental factors that play a big part in the disorder. It's believed that the condition is basically an imbalance in the brain with the neurotransmitters. If these neurotransmitters are not in balance, basically the brain's mood regulating systems won't work the way they should. For some teens, the first episodes that usually happen are caused by stresses such as family death, parents divorcing, or other traumatic events. Bipolar disorder is classified into 3 different types. Bipolar 1, people with this type have at least one manic episode with episodes of depression. Bipolar 2 is when a patient doesn't never have full mania, but has hyperactivity or impulses with episodes of depression. And then there is the third, which is cyclothymic disorder, which is a very mild form of bipolar disorder, and it has less severe mood swings. And people that usually have cyclothymic disorder are usually wrongfully diagnosed as having depression. There are 2 phases of the bipolar disorder. There's the manic phase, and then there's the depressive phase. The manic phase usually lasts for days or months, and some of the symptoms are the following: easily distracted, little need for sleep, poor judgment, poor temper control, reckless behavior, and also very agitated or irritated. The depressed state usually has symptoms as daily low mood or sadness, difficulty concentrating, remembering, or decision making, eating problems, fatigue or lack of energy, feeling worthless, hopeless, or guilty, loss of self-esteem, thoughts of death or suicide, trouble sleeping, or sleeping too much. People with the bipolar disorder usually have a high risk of suicide. Patients that usually abuse alcohol or other substances have basically these symptoms get a lot stronger and can be a lot worse. After describing these two phases, during these two phases, the phases overlap, and when they overlap, it's called the mixed state. The manic and depressive states can occur together or quickly one after the other. Most people with bipolar disorder can be helped, but psychiatrists and psychologists are the only ones that can first diagnose the disorder. Sadly, many people that have the disorder have not been never diagnosed, or they've been diagnosed wrongfully, and without treatment, the bipolar disorder can get a lot worse. The symptoms can really cause bad relationships, basically damaged relationships. They can basically harm your job or school performance, and even have you have thoughts of suicide. But the disorder can be treated, and people with the illness can lead to full, productive lives. Today, there's no cure, but with proper treatment, patients are able to gain control of their mood swings and their symptoms. Because of this is a lifelong and reoccurring illness, the treatment needs to be long-term, of medication and psychotherapy. When treating bipolar disorder, drugs called mood stabilizers such as lithium and valproate are usually used first. Antidepressants, medications, antipsychotic, and anti-anxiety medications are also prescribed. If there is no response to the medication, there's also other therapies. One is actually called electroconvulsive therapy, ETC. It can be used during the manic or depressive phases of the disorder. ETC is an electrical current that causes brief seizure while the patient is under anesthesia. And ETC is very, very effective. After this treatment, there's usually a transcranial magnetic stimulation, TMS, and TMS is at high frequency magnetic pulses to target affected areas of the brain. People that have this disorder and they're going through these manic and depressive states should sometimes be hospitalized because they can harm themselves or harm others. Even though it's been a short time since my family and I have known about the disorder, my sister has been able to stabilize her moods and her symptoms through effective medications and therapy. And I hope one day that she's able to live a full and independent life. I hope this has been very informative of the bipolar disorder. Thank you for listening.
Yay! 7 minutes, 45 seconds.
Yay.
See?